Hands to our health this morning. Houston Health Department says RSV cases are on the rise, nearly 12 times higher than this time last year. Meanwhile, flu and COVID-19 activity levels remain low so far this respiratory season. So joining us now to talk more about the increase of RSV is Dr. White, Deputy Public Health Authority at Houston Health Department. Dr. White, good morning. Thank you so much for your time this morning.
Happy to be here. Thank you for having me.
So, for a lot of people not familiar with RSV, they might be familiar with flu, with COVID-19. Talk to us about what RSV is, how it works, and how it differs from flu and COVID.
So it's understandable that many people aren't as familiar with RSV. We've only had sort of vaccine available for the past 2 years. So RSV, as similar to many other viruses, kind of gets lumped into that virus category when we say, oh, you might have a cold. What's important to know is with RSV, you can still get cough, congestion, runny nose, poor appetite, fever, and just the overwhelming sense of not feeling well. And unlike flu and COVID, really it's impactful for our most vulnerable, which are our infants, and then those older individuals, 75 and older. So it's been around, but it sort of got lumped into a big category. But now that we have some resources available, we're hearing more and more about it.
Is there a vaccination? We know there's a vaccination for flu and COVID-19. Is there a vaccination for RSV?
So there is. That's good news. We've got a vaccine now that's available for individuals who are 75 years and older. They're candidates to get the vaccination. For 60 to 74, with sort of that shared decision making with their provider, it's available. Certainly if you have conditions like heart disease, lung disease, immunocompromising conditions, it's available. We're excited because now we have a vaccine that we can give pregnant moms between their 32 and 36 weeks. That's going to give protection for their baby. And that's important because usually RSV is this time of year. So babies born this time of year have a sort of heightened risk of contracting RSV. So, when you're pregnant, 32 to 36 weeks, this time of year, you certainly want to get that vaccine. Babies born, the moms did not get the vaccine prior to delivery, and they're born this time of year. Even some babies born real late, early into this year, and they're sort of coming into their first RSV season. Those babies are also have an opportunity to get what we call the RSV antibody. And that, again, is available to give that protection to infants because we know that 6-month-old, 9-month-old, they can get pretty sick pretty quickly. And certainly we don't want those babies to have a hospitalization.
Yeah, their immune system isn't up to speed just yet at that age. For folks who contract RSV, your suggestions, Dr. White, on how they should manage the illness?
So this goes that sort of old-fashioned sort of how to handle cold and flu RSV symptoms. You certainly want to manage the fever. So that Tylenol, acetaminophen, ibuprofen. We avoid aspirin in children. And then supportive care, you really want to maintain hydration. And sometimes with these infections, very quickly you're not able to keep up with fluid intake. And so you end up getting dehydrated. And so that's, something we want to make sure people protect themselves from, of not getting dehydrated. And if so, you want to go to the emergency department and probably get some fluids to help sort of get you over the hump. With babies, what's important to remember too is if you're nursing, you have a nursing baby and they're not nursing as they had been previously, you want to get in front of that very quickly to help to keep them from getting dehydrated from a nursing perspective. So again, you want to go to the emergency department, have your baby looked at, make sure we can give that baby some additional IV hydration until they're able to get that stamina to go back and nurse as appropriate. And then if you're on medications, we also say, you can take the Tylenol, the ibuprofen, but if you want to take some over-the-counter medications, it's always best to talk to your doctor first. There are some medications, just because they're over-the-counter doesn't mean they won't have a sort of contraindication to maybe your high blood pressure medication, your heart medication, and for some children, their behavioral medication. So you first always want to talk to your provider first to make sure that those over-the-counter medications are safe to take.
Okay, all good information, Dr. White. We appreciate your time during this holiday week. Thank you so much for coming on the show.
Thank you for having me.
Thank you.